You have to give showers. You have to clean feces and all that stuff. I would say if you are doing it for sole purpose of getting a PR, don't do it. Every university has 800 to 1200 hours of university placements that you have to attend to get the degree.
One of the degrees where people can actually work in their occupation before they even graduate, right?
That's true, yes.
Alright, hello, welcome back to another video on this channel. This is going to be a very interesting and very in-demand video. This is my friend Aditya, whom I met, three and a half years ago?
Yes.
When we originally came to Australia, both of us worked at good old days, good bad days.
Oh yeah.
But he is pursuing a Bachelor of Nursing here in Adelaide. And he's here to share his experience around what the degree was like, what he studied, full-time job, experience, PR, everything. Because as you would know, Bachelor of Nursing is a very in-demand degree.
That's true.
In-demand occupation. Healthcare has always been on a rise. But before we get into everything, introduce yourself, where you're from.
Sure.
Obviously, you've been here for three and a half years, but talk about how has it been like in Australia.
Yeah. So my name is Aditya Sharma. I'm 21 years old, and I came to Australia basically after finishing my high school, after grade 12.
Yeah.
In super medical stream. So I wanted to continue my future studies basically in the medical field.
Yeah.
So I chose nursing.
Got it.
And while I was studying nursing, I did a couple of other degrees as well.
Okay. In Australia?
In Australia.
Got it.
Yeah.
What other, are those certifications or degrees?
Certifications, I would say.
Got it. We'll get into that later around how his part-time experience was like as well, because it's one of the degrees where people can actually work in their occupation before they even graduate, right?
That's true, yes.
So talk about Bachelor of Nursing, because it's a stereotype, but people say that I'll do a nursing degree and get the PR. But how is it like studying a Bachelor of Nursing? Is it so easy?
I would say it's not bad, but the first 2 years were pretty good.
Yeah.
But I would say the last year it's pretty hard.
Okay.
All those assignments and with the placements.
Yeah.
Plus you have to work
Yeah.
part-time or full-time is your choice, but yeah, it's
Got it.
sometimes like it's really hard sometimes. Yeah.
Got it. So if I ask about the nitty-gritties of what is actually being covered in the degree, what are you actually learning? If you could answer that.
Sure. So basically, in my first semester, I don't remember exactly, but
Yeah.
So it's like they will give you introduction about the basic human body
Yeah.
in the first semester. You have assignments and you got some exams that you have to do while you're sitting in the university.
Yeah.
And also foundation is like the basics of nursing, like what we will do when you will meet people, greet, and all those how to do documentation and following the
Health
rights.
standards and
Everything is
Yeah.
included in the foundations. Yes.
Got it. And then second year, what does that look like?
Second year is basically I would say assignments plus placements.
Yeah.
So in first year we got 160 hours of placement. That's basically, it depends, but basically I got in aged care. So you have to do 160 hours in aged care.
So this is unpaid work.
Everything's unpaid work.
Okay, so unpaid work of placements in your first year, right?
Yes.
And 160 minutes.
Hours.
Sorry, 160 hours.
Yes.
How is it distributed? Is it distributed amongst 3 months? 1 month?
Just 1 month.
1 month.
1
okay.
month, yes. So it's like basically 28 days,
Got
5
it.
days a week.
Got it. So you're looking at basically working 5 days a week full time.
Full time, yes, but without
and
getting
then
paid.
Without getting paid. So you have to look at weekends
Yes.
or after hours work to keep yourself afloat.
So basically what I think, students can't work during the placements.
Oh, okay.
Yeah, but some students do. I didn't.
Yeah.
And
Yeah.
also in the aged care, it's basically like 4 weeks. So first week you have to you get the overview of everything in the facility. So your university basically allocates the placements.
Okay,
Yeah.
so you don't have to stress
No.
about where you need to apply or anything like
No.
that. Okay, got it.
Yes.
So that's 160 hours of placement in your first year.
First year, yes.
And second year, is there another set of
so yes,
placement?
so second year is another set of placement. Plus you have to get to learn more about human body. So it's the subject called Human Body 2.
Okay.
So like more depth in the IVs and all that stuff.
Got it. Got
Yes.
it. And then another set of placements in
So we got in last year we got 2 placements.
Okay.
So it's 320 hours each.
Jeez. Okay.
Each
And
without,
this is
without getting paid. Yeah.
distributed in 2 semesters basically.
Yes, 2 semesters, 2 different semesters.
semesters.
Yes.
Wow. That's a lot of unpaid work that you're doing.
So basically, it's like every university has a different rule.
Mm-hmm.
So every university has 800 to 1200 hours of university placements that you have to attend to get the degree.
Got it. And to get registered as well, or is there another process to get registered as a nurse?
No, so it's to get registered, you have to apply for the registration.
Okay.
You have to, for international, I'm an international student.
Yeah.
So you have to get that English requirement test first.
Yeah.
So you have to pass through the university.
Okay.
I mean, like you pass the university, right?
Yeah.
So you apply for that IELTS or PD exam,
Yeah.
whatever
Yeah.
so it's suitable for you. And after that, you apply and you get the registration.
Got it. So it's just applying, no exams or anything like that?
No.
Okay, got it. Then you mentioned RN, right?
Yes.
Now I know what RN is. It's a registered nurse. There's another term, enrolled nurse, which is EN.
Yes.
What is the difference?
So EN is basically enrolled nurse. It's like a diploma of nursing.
Okay.
And RN is registered nurse. It's a degree and bachelor's of nursing, like
Okay.
Yeah.
So can I say that RN is
a senior level.
better, like yeah, see on a more senior
Oh, yes.
level
Of course.
than EN?
Yes.
All right. Now let's go back a little bit to the stereotype of choosing nursing for pure PR purposes, right?
Yeah.
Who is this occupation made for? Like, what do you need to have to one, obviously survive it, but also enjoy it a little bit? Like obviously you said that you're from a medical background,
Yes.
right? And you wanted to get into this.
Yeah.
But for someone who's doing it purely for PR purposes, what will they face?
I would say if you are doing it for sole purpose of getting a PR, don't do it.
Okay.
It's not worth it, because you should be empathetic, and that compassionate behavior comes from inside. You can't just like I will do it. You have to have that feeling to
Yeah.
care for people.
Yeah.
So those are the people that needs to get into nursing.
Got it.
Yeah.
And talk a little bit about your friends' experiences, right?
My friends,
Yeah. What has their experience been like? Like, are they hating it now that they've
I would
chosen
say
it?
in the first year, it's a different experience, right? Because it's mostly as a male in nursing, it's a really different scenario.
Yeah.
It's like 90 to 95% of female staff
Female
there.
Staff, yeah.
So, but you get used to it. All my
Yeah.
friends are loving it now.
Got it.
Yeah.
Okay, that's good.
Yes.
Even if they've chosen it purely for PR
Yes.
purposes. Got it. And I'll put you on the spot here and ask you what your placement hours look like. Like, what is the actual work that you're doing in that facility, wherever you get placed?
Okay. So I would say like in first year, that 160 hours in aged care,
Yeah.
you get to do the ADLs. ADLs is like all daily activities of the older people.
Okay.
Like giving them showers, helping them with the feedings. You have to basically do everything that an older individual needs for his
Got it.
or her daily activities.
Got it.
Yes.
Got it. And then once you get more experience in your second and third year?
Yes. So second year is basically you get to get an overview in the hospital.
Yeah.
So I get placed in a hospital,
Yeah.
in the Royal Adelaide Hospital. So it's a nice hospital.
That's one of the very, I think the most reputed hospital
Reputed
there in
hospitals,
Adelaide?
yes.
Yeah.
Probably one of the best.
Yeah.
And there I was working in the ED, like doing my placement hours, but like working in the ED. They learned a lot.
Yeah.
Yes.
And so if I were, maybe now that you know everything,
Yeah.
you would have
Not
not,
everything, most of the things.
everything as in about the industry.
Oh yes, yes.
So if you could, where would you get placed? So basically what I'm trying to ask you is that not everybody would like to be placed in an aged care facility. Do you have any control on where you're going to be placed throughout your degree? Like, can you communicate your preferences to your university?
Yes,
or is
you
it
can.
like a ballot system?
Okay. So basically, university allocates the placement to every student.
Yeah.
But you can put there's a form which is known as a pre-allocation form. You
Okay.
can fill that form and submit it to the university.
Got it.
But there are certain rules that you have to follow. Like if there's a condition, medical condition, or some circumstances that make you to go specifically to that place, those are the reasons you are allocated.
Got it. And if I talk about your career trajectory, right? You did your medical in your year 12.
Yes.
Moved here for nursing.
Yes.
So do you want to stay at a registered nurse path, or do you want to go and do your MBBS or your doctor, and what does your career trajectory look like?
I would say I would definitely study more because it's just the beginning, right?
Yeah.
As a registered nurse, you get like an entry level introduction to the like caring for people, all that medical things. But after doing nursing, like after doing the bachelor's, I would say you have to do. I'm not sure what's the name of that exam, but you have to do that medical exam to get into the medical college.
Okay.
Yep, I think it's called UCAT or MCAT. I'm not sure.
Yeah.
But
okay.
Yeah.
And then you prepare or study to become a doctor. Then.
Yes. So it's like basically 4 years, then 4 + 2, 6 years after nursing.
Got it.
Yes.
And so these videos are watched by a lot of different demographics, right?
Yeah.
But if I purely talk about India, people cracking the NEET exam is very hard, as you know.
Yep.
So for people who are preparing for NEET but aren't able to make it through, is this a good career pathway for them to move to a technically quote unquote a first world country, and then still follow their dreams of becoming a doctor at some point?
I would 100% agree with that. If they want to, they can. It actually depends on the financial situation of an individual.
Yeah.
If they can support their education, their parents, of course you can come. It's really nice to come and work here.
And if I talk about, and don't give me the exact pay, like the range, but how much did you spend, or how much can a person wanting to pursue this degree look at spending for their 3 years of bachelor's or diploma, whatever?
A lot. So basically, I would say around 100.
Around 100 grand?
Yes.
Got it. Cool.
Yes.
Coming to one of the most major pain points, I don't feel that it is a pain point in nursing, but in other occupations. What is the job market like right now? Is it very easy to get a job in nursing? If it is it very easy to get a job of your liking? How does the job market work in nursing?
Actually, I'll be honest with you. It was very easy when I started nursing, but like in a couple of years, a lot of students started doing it.
Okay.
So not many places in the metropolitan cities have vacancies.
Okay.
But in the rural areas, remote areas outside of Adelaide, there's still a lot of vacancies there.
Got it. Is the job process or applying for a job looks the same for nursing? So you also have a resume, you also have a cover letter,
yes,
you also have a portfolio, or how does it
true.
go?
So if you want to get a job, first of all, university supports students a lot.
Okay.
You can there's career services that you can go and give your resume or submit your resume, or you can do it yourself at your home.
Yeah.
Just look for different websites, Seek, Indeed. A lot of websites are there, and you can go to websites of private hospitals to look for any job vacancies.
Yeah.
So it's easy. Just submit your resume, like make a nice resume.
Yeah.
Then cover letter is not mandatory, but I would suggest to make one.
Yeah.
So after you submit your cover letter, and if you get selected, they will ask for your referees and all that stuff.
Any other things that you have to attach with your resume, be that your first aid certificate or your APRA registration or anything?
I'm so used to it, I'm not even considering that as a different document.
Exactly.
So there are
talk about everything that goes into it.
There are a hell lot of documents that you need, and you need
just to apply for a job.
Just to apply for a job.
Okay.
You need. I'll start with manual handling certificate. There's a first aid certificate.
Yeah.
Not a certificate. First aid training. CPR.
Yeah.
So you can do first aid and CPR in one day.
Yeah.
And first aid is valid for 3 years, and CPR is valid for 1 year.
Yeah. As of 2025 June. Yeah.
Yes. If I do a CPR training today, it's valid for 1 year.
Got it.
So I have to do it again next year. You have to get the police clearance as well.
Okay.
Police clearance. You have to get influenza shot. The flu shot every year. And sometimes you have to get that hand hygiene certificate. You have to get, I would say, Infection control certificate as well, as far as I remember. Yes, those are certain main documents. Main one, you have to get the immunization clearance.
Got it.
Yes.
What does the registration process look like? How do you how do you become a registered nurse?
Yep.
Let's say now you've graduated, right? One of that step is complete. You get your completion document. You get your transcripts and everything. What all do you need to apply for registration?
I would say you need that English test.
Yeah.
So you should have 7 each.
Seven in
Seven
each
each in
band.
each, yeah, speaking,
Yeah, okay.
listening, writing,
Yeah.
and reading.
Okay.
7 each, and yeah, you just need your university transcript, and like you have to pay like one-time fees to get the registration.
How much would that be? If you
I'm
remember?
not too sure. It's around, I think, $200 to $300.
$200 to $300. And as I know, nursing is one of the few occupations where people who are still studying get to work in the same occupation, same industry, be that aged care, be that nursing, be that hospitals.
Yes.
So, what was your experience like? Obviously, we worked in hospitality together,
Yes.
but how do you get to work in nursing, work in aged care as a student?
So I'll tell you my story. What I
Yeah.
did when I came to Australia. For 6 months, I worked in hospitality.
Yeah.
I have to start somewhere, so
Exactly, yeah.
I work as a bartender and stuff with Anshu. It was a nice experience.
We didn't get to do a lot of bartending, do a lot of waitering.
Anyways, so after 6 months, I tried to study more, so I got certificate 3 in aged care.
Okay.
Um,
How much did that cost, if you don't mind me asking?
I completed certificate 3 in aged care and certificate 3 in disability both.
Uh-huh.
So overall, at that time, around 3 to 4 years ago, it was $1,500 to $2,000
It
that time.
must have increased, but yeah, go on.
It was 1,500, yes.
Yeah.
So it was really nice working in aged care. So after my Adelaide Oval, I applied to different residential facilities, like
Yeah.
in aged care facilities.
Yeah.
So there are a lot of vacancies in aged care
Okay.
as a carer, personal
Are
care
there-
worker.
Yeah. Still, is that the case?
Yes.
Cool. Okay.
It's
go
still
on.
the case. So I got a job there. Basically, while I was studying my nursing, I learned the basics.
Mhm.
You know what I mean?
Yeah.
I learned the aerials. I was looking at the nurses, how they do everything.
Yeah.
After in my first year, after I did my aged care work, I did
Yeah.
that for around 1 year,
Yeah.
the personal care worker. Then I applied as an AIN.
Okay.
It's like assistant nurse.
Okay.
It's a post. It's like below EN,
Okay.
but above a personal care worker.
Got
It's
it.
in the middle.
Got it.
So basically, you can't give meds because you need to have registration for that.
Yeah.
But you can check the vitals. You can check BGLs. You can do the assessments.
Yeah.
Not the neurological assessment, but all the basic assessments you can do. And
Got it.
if you think like the patient is declining, your duty is basically to one-on-one special or float, depends, and you just have to report the nurse.
Yeah.
Like my patient is doing this.
Yeah.
This. Yes.
Is it safe to say that that work is easier than the personal care worker
Yes.
role?
Yes.
And obviously, if you can go into the details, I've heard many stories, and some of them might be, some of them might not be true. But as a personal care worker, you have to do a lot of things that we are not used to doing, right?
That's
You
true.
see where I'm going.
Yes.
So if you can give a bit of detail, because all of this from where people are watching right
Yeah.
now looks very, we'll be able to do it because
No, okay.
the hourly working rate is
Yes.
more and everything. So go into the details a little bit.
So if you think of aged care, the things I'll be honest, yeah, the thing that comes in mind, you have to give showers,
Mhm.
you have to clean feces
Yeah.
and all that stuff. So don't get embarrassed. If you're getting embarrassed, just don't do nursing. It's
Yeah.
not for you.
It's not the.
It's
yeah,
not for you.
exactly. Got it.
So it's like basically caring for people.
Yeah.
And if it's coming from your inside,
Mhm.
it's like daily job. It's like that's
Yeah.
fine.
Yeah.
I have to do it.
Again, I'm not asking you to go into the details,
Yes.
but give us a range of what a personal care worker first can earn while they're studying. So an hourly rate.
An hourly rate. See, if you're working through an agency,
Mhm.
the hourly rate is definitely high, a little
Okay.
bit high. And if you're
So
working
give us a range.
I would say 30 plus.
30 plus an hour on the weekdays?
Yes.
Okay,
30
and on
plus.
weekends obviously it's 30, late 30s and early 40s.
Yes, on the weekends, yes.
Got it. And then
If you're permanent, your pay rate will be low, a little bit low, like $2 to $3 less.
yeah,
But you will get other facilities, like you will get gym memberships, discounts, and you get sick leaves, annual
Yeah.
leaves. You get paid for everything.
so this is you're talking about
A permanent
at a residential
as
facility.
at a residential
Got
facility.
it.
Yes.
And then now talk about AIN.
Yep.
What is the hourly pay rate like as a student, right?
As a student, yes.
Yeah.
So I would say it's definitely equal to or more than a care worker.
Okay.
Yes.
So let's say starting from 35, 36, somewhere around that.
I would say 30 plus again.
30 plus again,
Yes.
and then weekends obviously you get penalty rates and
That's
casual
true.
rates and
Yes.
everything. And then the next step is RN, where you're going at, right?
Yes.
That will obviously a full-time role, a package.
Yes.
So like from what particular figure can the package start from?
See, I would say there are different levels in RN as well.
Okay.
So as a new graduate, like as a T triple P, I would say, you know what a T triple P is? So once you graduate, like your degree is done,
Yeah.
so the hiring of the students gets started before your degree like finishes,
Yeah,
right?
yeah.
So you are at least sure of getting a job,
Got it.
and you are working under supervision
Yeah.
because as an RN you get a lot of responsibility,
Yeah.
and so that you just don't go and kill someone.
Yeah.
So you have to work under supervision.
someone, yeah.
You get the pay rate of an RN, but at least it's like supervision, so you are protected
Got
in
it.
that way.
Got it.
Your
And-
license is safe.
Got it. What's the annual package?
As a new RN, new graduate,
Yeah.
I would say 70 to 90.
70 to
70
90.
to 80, 90, yes.
Got it. Do you have friends who are pursuing nursing in Melbourne, Sydney? What is it like
Yes.
there? Talk about from a PR perspective.
Of course. See, nursing is an in-demand course, right?
Yeah.
So wherever you go, you're gonna get a job if you're capable,
Yeah.
and you need to be an extrovert.
Yeah.
You just can't just say and just go and sit in the interview. You have to
Yeah.
clear an interview as well.
Yeah.
So the panel sits, and you just have to represent yourself, like what your qualifications are and all that stuff.
Got
But one of my friends, she's in Melbourne.
Yeah.
She's in Ballarat.
Also
You know,
regional.
Regional Melbourne.
Yeah.
And it's really good there as well.
Okay.
Yeah, it's similar to here.
Okay.
But one of my sisters, she's doing nursing as well. She just got her PR in Tasmania.
Got it.
It's really nice. You get, I think, extra 5 points there if you study in Tasmania. So
Got
yeah.
it. Got it. And obviously, the more metropolitan cities you go, the higher you spend on a nursing degree as well. So Melbourne and Sydney will be more expensive.
Yes, but the period is good there as well. So
Where it is better than
better
Adelaide?
than Adelaide, 100%.
Better than
Yes,
Adelaide. Got
but
it.
it's like a little busy.
Yeah.
So
any last pieces of advice for someone who's considering this degree? Also, one from getting into the field, and also secondly, because unfortunately that's a stereotype from a PR perspective.
yes, see, don't start nursing if your sole purpose is PR. There are a lot of other occupations as well. Physiotherapist, operation theater specialist, a lot of things like you can start with.
Pharmacist.
But if you're pharmacist, yeah. But if you're doing nursing, just if you have that caring thing in you,
Empathy,
and
sympathy,
all
yeah.
that stuff, so it's really nice.
Got it.
You can pursue your career in
Alright, cool. That was it. I think we covered everything.
most of the things.
Most of the things.
Yes.
Anything that you would like to bring to light, which is important for prospective students to know?
Sure. Just focus on your studies while you are in here. Don't
Yeah.
go like I have to work,
Yeah.
because once your work is done, like once your studies is completed, you can work forever.
Yeah.
So just focus on your studies.
Cool. If you have any questions or anything that we missed out on or didn't explain in detail, put it down in the comments below. Do you have LinkedIn?
No.
I'll put his Instagram in the description. So if you want to get in touch with him, feel free to get in touch with him. Or if you have a lot of questions, put it down in the comments below, and we'll do a part 2. As for now, you're in Adelaide, so we
Sure.
can do a part 2. And like, share, subscribe, do your thing. See you in the next one.